basically acne is what all of us or most of the teenagers are suffering today nowadays. So the basic causes of acne is a lot of time nowadays people are actually listening to, they have some superstars on the YouTubes and videos, and they're actually having this source of information wrong. Concerned about, but these days we have seen so much of adult acne. Like, people who never had acne before are now getting it in their 30s and 40s. Second thing, whenever you're using a foundation, it has to be
because it's a pandemic situation right now and we all are using masks, but I guess for me also I have experienced some rashes, some dry skin and all, and especially acne in the portion of mask.
Acne is not permanent, but scars, they are permanent. So if you want to cure acne, there are various techniques, and we do have them in our clinics.
Hi doctor, pleasure to meet you. Doctor, I'm basically having today a lot of questions about acne.
Okay.
I guess that's a very common issue, which at least once in a lifetime we all face it, right? Even I had it like a long back. So, what are the basic causes of acne?
Okay, so basically acne is what all of us or most of the teenagers are suffering today nowadays. So the basic causes of acne is genetic, that your genes, hereditary. So if your parents or your grandparents are having oily skin, then it's quite possible that you would also inherit that kind of skin, and then probably once you turn teenage you can develop those acne. Then the second cause is your diet. Of course, diet plays a very, very important part in acne. If you're eating a lot of oily stuff, those oily stuffs and the cheese and the butter, the fast food that everybody is eating these days, that also affects acne. The third is some kind of hormonal problems, like a lot of ladies, they are getting polycystic ovaries, or they're having thyroid problems. So all these problems can also exacerbate acne, increase acne. And of course, the third thing is if you're taking any medicines, like drugs, The fourth is stress. So stress-induced acne is very, very common these days. And the fifth reason for acne is basically if you are using wrong kind of products on your face. A lot of time nowadays people are actually listening to, they have some superstars on the YouTubes and videos, and they're actually having this source of information wrong. So they want to experiment with those products on the face, and it just doesn't, suits them properly, and that's when they get more acne issues. So so these are like common things that people develop acne. Again, acne, it comes in two age groups. Generally it's the teenage acne that people are concerned about, but these days we have seen so much of adult acne. Like, people who never had acne before are now getting it in their 30s and 40s, and they come to us and they say, oh doctor, I didn't get it all my life, and why am I getting it today? So those acne are generally related to hormonal issues, because of their stress and because of the makeup that they're using, the wrong products on the face. So I think if you take proper care of your skin, you can avoid acne, but if you're genetically prone to it, you can only minimize those acne, and you can minimize the effects, the scars and things like that.
Alright, and coming to that last part of the conversation, like makeup, right?
Yeah.
I guess nobody can avoid it. Of course, we have to use it in this generation, right?
Correct.
So, how can we minimize the acne with using makeup?
Yes. So I think if I tell my patients, okay, your makeup is wrong, or probably you should avoid wearing makeup, I'm sure they'll just change the doctor. They will not come to me again, because makeup is such an essential part of their life. So honestly, what I tell them is, whenever you're using products, especially when you start the makeup, always use a primer. So primer also helps in setting up the makeup, but at the same time, if you're using a good primer, it is the basis for not developing acne. It's protecting your skin. It's forming a layer between the makeup products that you're using and your skin. What is the primer that you have to choose for? So you have to basically look for primers which are non-comedogenic, oil-free and gel-based. So if you find any of these in your priming products, that would actually match your skin type.
Okay.
And sometimes, yeah, sometimes it is that some primers, they also have all these cosmetic products, they have things like preservatives, and those can sometimes react with your skin type. So of course, you might say, oh doctor, I did the right things, I did non-comedogenic gel base, and still I'm getting acne. Then probably it's that particular preservative that's not going with your skin. So probably you might want to try one or two before you get those right. Okay. The second thing, whenever you're using a foundation, it has to be mineral based foundation. So all your products, just read these tags: mineral based, non-comedogenic, oil free, and you will be good to go.
Okay, alright.
And always, when you're doing makeup, after makeup, when you're done with your day, make sure that you use a proper cleanser for your skin and use a toner to remove the makeup very well. The makeup generally settles in your pores and it blocks the pores. Those are the pores from where the oily secretions are actually coming out. So if you're blocking your pores, those secretions will actually start painting up inside your skin, and that's the problem. That's where you will get the acne. That's where you will start from the inflammatory and the infected stage of acne.
Okay.
So that's the best part. You have to basically clean your skin well. Make sure when you're cleaning your skin, don't use harsh products. Don't use something which is salicylic acid based because you're getting acne. Just because you want to rub your skin really well to remove all the dirt. It doesn't work like that. If you do that, what you're going to do is make your skin dry and damage your skin as well. So use products which are for sensitive skin.
So first we have to use the makeup remover or directly a cleanser?
I honestly believe you wash your face first properly with a mild soap, mild cleanser, and then use a toner for sensitive skin to remove the makeup on. I always advise my patients, don't leave any kind of toner on your skin. Once you finish the toner, again just rinse your face one more time with water, doesn't harm. Then use a proper moisturizer just so that you're not damaging your skin. I think those steps, if somebody follows, it would really be a boon.
Okay.
I'll lose some business. For sure.
Alright, and coming to the mask, because it's a pandemic situation right now and we all are using masks, but I guess for me also, I have experienced some rashes, some dry skin and all, and especially acne in the portion of mask. So is there any way that we can prevent, or
honestly, mask does have a relationship to acne.
Okay.
Now how? We are basically occluding this part of the skin, right? And we are breathing that air. So there's a lot of moisture in that air, and there is heat in that air, and then there are summers, and then you don't know what kind of situation you are in. So of course, that mask is going to exacerbate conditions for some people. Not for everybody. Like I would wear mask for 8 hours, but I am in air condition, it doesn't affect me. But yeah, when you come in humidity conditions and you're wearing mask, it's occlusive. It's like blocking everything. You're not letting your skin breathe. So of course that does causes some problem in some people. And honestly, what we can do, probably use a different material of mask that you're wearing. So something like which is more breathable material, like more like cotton, and which doesn't have any colors in it, because those colors can itself cause irritation on the skin. So those nowadays we are getting those printed masks and designer mask, and so I would go more with like plain white mask, or probably which are more cotton, and then you can obviously wear your surgical mask on top of it if that is the one which is irritating you. I think that could be the better way of avoiding acne, and then just follow the steps of cleansing and toning your skin and moisturizing your skin well. So again, I think those points should help us, because in pandemic, I'm sure we cannot stop mask.
Yeah, and do we have to change the mask often?
Yes, we do. So this is one more big problem, and this is what I'm seeing everywhere. People are just putting their mask on their cars, anywhere in their purses, and then they would just remove those masks and wear it. That is completely a no. At least change your mask every 4 hours if you're wearing it continuously. Because if you start wearing mask more than 4 hours, you will see those fibers will start irritating your skin. Because of humidity, those fibers also start turning loose in the mask. So try and change your mask minimum at least 4 hourly, but if you are in humid conditions, maybe even earlier.
Okay, and trust me, she looks more beautiful than not even she's putting a makeup, but she looks very pretty. So
Thank you so
we
much.
want to know the all the tips we can.
My secret. So Honestly, there is no big secret. Okay, there are some things to
That's
do
a
with-
big lie.
no. As a dermatologist, I won't. But yeah, I think what I really do on regular basis is cleansing, of course. You have, as a dermatologist, I have to take care of my skin.
Yeah.
So cleansing, toning, that's what I do regularly. Putting a moisturizer, sunscreen, this is really important. And of course, the secret is retinol. So retinol is basically a serum. Okay, it's a vitamin A serum, which will help for people with acne. So I myself am an acne-prone skin.
Okay.
I have a mixed combination skin.
Mixed
so
combination.
Combination means I'm oily plus dry. So
Yeah.
I have a T-zone. So what I generally do is I do apply a retinol serum at night before sleeping, and I think that does that magic. So it gives you that glowing
That's the
skin.
point. Alright. And what all other things we can take care of?
So honestly, I think see a dermatologist if you're having an acne problem. That's really important. Don't try home remedies on your own, because a lot of time I just had a patient just like 5 minutes back who wanted to put ice on the face. Okay, and she was a dry skin. And she had some of these tips from videos that putting ice on the skin will get her skin glowing and get collagen and will be anti-aging. Logic. I was just talking to her. I was like, logically, if you put ice, what is your skin going to do? Maybe ice will kill the bacteria on your face, so it's good for oily skin. Maybe. Will it reduce oils? Yes, maybe, because it will reduce the blood supply to those oil supplying glands, and then maybe it will reduce the oily secretions as well. But what will it do to a dry skin? How would it increase the collagen? Your body and your skin, they are adapted to a particular temperature, which is a normal temperature of our body. It's around 37 to 39 or 40. But then 40 is like high grade fever. You're down with fever if you're having 40. So how would ice, which is 0 degrees, would help your skin in any way? So yeah, there are a lot of new things which are happening. There is something which is called as cryofacials, which basically are using ice sprays for facials. But then those facials are done at a clinic in a controlled setting. You wouldn't know they'll keep rubbing ice for maybe 10 minutes on the skin or 15-20 minutes on the skin and damage the skin in the bath, right? So I think see your dermatologist and learn from them how to actually take care of your skin will go in the long run, because it's the largest organ of your body. And I don't think you should just casually take it.
Okay. And even if we're taking a lot of care for our acne, the scars will come, right?
Yes.
So what are the treatment procedures if I get the scars?
Yes. So honestly, why we're all doing this acne treatment is to prevent those scars. Acne is temporary. Acne will basically come in your life according to your genetic timeline. Like I got acne for 2 years, but I have my aunt who's getting acne till like what? She's 55. She's still getting acne. So everybody has a timeline for acne, which is genetically decided. Now, so what is the big deal about the treatment? The treatment is to prevent the scars. Acne is not permanent, but scars, they are permanent. So what we should be doing is taking care of acne and not letting the scars form at all. But if the scars form, then there are so many things that we can actually do and honestly do, which will make them look better and their life better, because it really gets your confidence back. So basically for scars, there are different kinds of scars. So based on those scars, there are different treatments which are available in the clinic. We basically can start with like peelings, some kind of peelings which will help in resurfacing the scars. But for the deeper ones, you can actually do fillers. Those are like, put
for the pores.
For those deep hole ones.
Yeah.
So if you have those deep holes, we can actually fill it up with a filler product and make it leveled up. And then there is something that you can combine it with a resurfacing CO2 laser, where it tries to resurface the skin. The other procedures that we use is PRP, which is platelet-rich plasma. This is done with your blood. So we basically take blood and we separate the plasma, platelets and the growth factors from the blood, and then those injections are given below the scars. So over a period of time, they help in collagen regeneration. It's a beautiful procedure, honestly. Actually, if you look at PRP, they basically call it as a vampire facial. It's popularly known like this in all over the world. It's because you're using the blood, and that's the reason why it's called like that. But then, yeah, it's a beautiful procedure. It doesn't involve any kind of chemicals in your skin because it's your blood, it's your products, and no downtime, no problems at all, completely safe. But honestly, whatever procedures we do, it all depends on the kind and the severity of scars. So, and always mixing up procedures helps the patients the maximum.
Okay.
So, for deep scars, we generally mix up with fillers and resurfacing so that we can take care of the proper tone of the skin.
Okay, so none of these are single sitting procedures?
No, they aren't. They aren't. Scars takes a long time to heal. So honestly, that's what I said. Prevention is better than cure.
Yeah.
So, but yeah, if you want to cure acne, there are various techniques, and we do have them in our clinics. So we'll be happy to help.
Okay, and this is in case we are having scars. And is there any treatments to prevent the acne if my skin is prone to acne?
Yes, there are. So if your skin is prone to acne, that's what I said. So I have an acne-prone skin, like before I said. So proper cleansing, proper toning, moisturizing your skin properly with proper products, and then of course, some kind of retinol serum or a vitamin C serum, so that you dry up the sebum. What is retinol going to do is basically dry up your sebum so that you don't form scars, acne at all.
Okay.
And the other things is, please take care of your diet. Okay, eat healthy, stay healthy. That's the mantra, I think, these days.
Alright, doctor. It was a very interesting and informative session. Thank you so much for your time.